Does your baby use a dummy or pacifier? Are you worried it may affect their teeth and their bite? Then join me on today's topic discussing pacifiers and your child's bite. Hi, my name's Peter Miles and I'm an orthodontist, and I aim to give you the straight talk about orthodontics. Orthodontists often get asked, is it okay for an infant to suck a pacifier rather than sucking a thumb or a finger? And firstly, for new parents, don't panic. Parents have enough to worry about as it is. It's normal for kids to have a sucking desire to age 2, but then this reduces and most kids have stopped by age 4. There's also reasonable evidence to suggest that using a pacifier does not affect breastfeeding, although you would want to have good breastfeeding routines in place. There's also some evidence to suggest that breastfeeding and possibly pacifier use seem to be related to a reduced risk of sudden infant death syndrome, or SIDS, although more research is required. However, it's much better to have a dummy sucking habit than to have a finger or thumb sucking one. It's much easier to stop the dummy sucking habit later. Maybe post it to the pacifier fairy. Now, if going the pacifier route, then silicone is preferred over latex, as some are allergic to latex, but both are BPA free. And using a pacifier for too long can cause what's called an open bite, where the front teeth do not contact on closing, whereas thumb and finger sucking habits are a known cause. Now, both orthodontic or regular dummies can cause open bites, so use the type your child is most comfortable with, but make sure you select the age-appropriate size. So by age 2, you can consider trying to wean your child off a pacifier, but if your child is older, many will stop at about age 6, which is when the adult incisors start to erupt. Aim to stop daytime first, as many still use it to comfort to help fall asleep, and daytime needs to stop before nighttime will. And the effect on their bite is time dependent, so once they're doing it less frequently, the impact on their bite diminishes and eventually disappears. Inner ear infections have been associated with pacifier use in older infants from 6 months to 2 years. So make sure they are clean and can be boiled or placed in a dishwasher for cleaning. Don't ever suck on it yourself and then give it to the child. Treat it as you would for a baby bottle teat. Now, if the habit is stopped by age 7, then most often, if they have an open bite, it will self-correct with normal growth, unless they still have another thumb or finger sucking habit. But some arch width problems where it's too narrow may require correction, so it is preferable for them to stop sooner. Never coat a pacifier in honey or some sweet substance, as this will cause rapid and painful decay in your child. So those new parents out there, don't stress. A dummy or pacifier habit is better than a thumb or finger sucking habit, which we will cover another time. Now, as always, I really appreciate you sharing this with friends and love your comments and questions. Thanks for tuning in. I'm Peter Miles, and I'll see you next time for more straight talk about orthodontics.